Hello, good morning, everyone. It's 10 o'clock, so I can go ahead and get started. My name is Connor Walsh. I'm a clinical toxicology fellow at the Georgia Poison Center, also a clinical pharmacist. I did my training at Grady Health System here in Atlanta for my clinical pharmacy training, and then I've continued on to pursue clinical toxicology through my fellowship here at the Georgia Poison Center. Today, I'd like to talk to you about pesticide toxicology and health considerations surrounding their use and exposures through my presentation today called Spray It, Don't Say It. So first, before I get started, a quick disclaimer, specifically for those who are seeking nursing credit contact hours. So it has been approved for 1 contact hour for nursing education. In order to receive this credit, you must view this presentation in its entirety. And at the end of the presentation, it will be a quick survey for you to fill out. And that survey will be emailed to you at the end of the presentation, and that would be how you claim credit. So to get started, I'm going to go over the objectives that I would like to cover during this presentation. First, I'd like to outline the use and significance of historical and modern-day pesticides and insect repellents. I would like to evaluate the environmental concerns and potential dangers associated with pesticide use, and model the appropriate safety precautions regarding pesticide use. So to get started, why are pesticides important? If you're like me looking at this slide, it might bring you a little bit of anxiety with all these insect icons on it. So pesticides are important to control these, control pests, control diseases, to prevent a lot of issues with plants and agriculture. So moving forward from that, we all know and are familiar with the mosquito. For hundreds of years, mosquitoes and other similar insects have been responsible for major disease transmission. And specifically looking at the mosquito, they are one of the most common vectors of disease transmission. And we've seen over the last several decades at least, we've seen malaria, viral encephalitis, yellow fever, dengue fever, and even as recently as the Zika virus and chikungunya virus. The WHO estimates that in 2015, there were 214 million cases of malaria worldwide. This led to 438,000 deaths. Of those deaths, 306,000 were children less than 5 years old, and had the mosquito populations been appropriately controlled and had proper precautions been placed around these people, these are all could be considered preventable deaths. So where do these insect repellents and pesticides come from? Well, it started hundreds of thousands of years ago. 4,500 years ago, the Sumerians have recorded using sulfur compounds to repel insects for agricultural purposes. 32,000 years ago, we've seen documentation of ancient Chinese using mercury and arsenic to prevent pests in their agriculture and from biting insects. Then a little bit more recently, but still a long time ago, the ancient Greece and Rome civilizations utilized smoke from burning a variety of substances to repel blights and mildews and other insects. We saw that the burning of natural plants, roots, and other materials have long been a method of insect repellent used by, like I said, the ancient Greece and Rome civilizations, but also Native Americans and other indigenous peoples around the world. Native Americans specifically were known to burn sagewort leaves to deter flies and attract horses. Other methods included burning papaya leaves and coconut husks. Other methods, they use sticky tar, almost like a turpentine or sap that came from trees, as an insect trap. So through the years, the methods of repellents and insect prevention, so to speak, has evolved through time. However, there has been one flower in particular that's been responsible for contributing to the widespread and modern insect repellents that we use today. And I'll talk a little bit more about it in depth to come, but that would be the chrysanthemum flower. So first, I want to talk about, I guess, an order of history that's more specific to the United States. So there is a class of pesticide called organochlorides, and the specific one I want to talk about is called DDT. Now, DDT is an abbreviation for a very long chemical name, and I'll say it once, I don't want to keep repeating it, but it's dichloro-diphenyl trichloroethane. That's why we call it DDT. But DDT is a colorless, tasteless, and nearly odorless chemical compound that is used as an insecticide. So looking here are some historical photographs of civilizations using DDT to help control mosquito populations. On the far left, you see these trucks that are basically moving around neighborhoods and cities and towns, spraying DDT into the trees, into the shrubs, and just surrounding areas to kill pests. In the middle, you'll see the airplane basically dropping DDT dust on livestock to prevent insect-borne diseases. And one of the most interesting ones here is the one on the far right, where they're basically spraying people at the pool with DDT to, I guess, get rid of horseflies. So this was heavily used, as you can see, very well trusted, and also very, very effective in getting rid of pests. So its historical use, it was developed in the early 1940s and was widely used until the 1970s when it fell out of favor and was ultimately banned from use. However, like I said, it was very, very effective, and one of its main purposes early on was controlling the typhus body louse. And according to the CDC, epidemic typhus was spread to people through contact with infected body lice. Epidemic typhus was responsible for millions of deaths in previous centuries, and now, vastly due to the use of DDT, it's now considered a very rare disease. It also eradicated malaria in many countries, saving up to 50 million lives. It averted 1 billion cases of insect-borne diseases and contributed to a world population expansion between 1950 and 1970 because it was cutting down on those insect-borne diseases that were killing lots of people. Next, I want to talk about another class called pyrethrins and pyrethroids, and this is where that chrysanthemum flower comes back. So pyrethroids are the natural chemical extract from the chrysanthemum flowers. This was discovered in first century China, where they would take the flower heads and grind it into a fine powder. They found that using this was preventing annoying insects and agricultural significant insects from becoming more of an issue. This developed more into commercial application by the early 1800s. So that was pyrethrins, but pyrethroids are more of a synthetic adaptation to pyrethrins. These work by have chemical properties that allow easy penetration to the insect chitin, which is like the insect's exoskeleton, like the hard shell around the insect. This works really great because insects are unable to break down these chemicals once it enters their bodies. However, mammals and other mammals and humans, we don't see much of a toxicity to these because we have the enzymes and proteins needed to break these down very rapidly. And even because of this, there's no environmental persistence. They break down very quickly, even in sunlight. So that's what makes them a very useful insecticide, because it targets specifically to the insects, and we don't see much of an effect otherwise. As I mentioned before, the pyrethroids are the synthetic derivatives of the natural pyrethrins, and these are a little bit more environmentally stable. So the pyrethrins do not last long in the environment. However, pyrethroids are a little bit more stable and can be used for agricultural use. So there are a couple of different types of pyrethroids, and I won't go too in depth with them, but you have type 1 and type 2, and those are more based on the chemical properties and makeup of the pyrethroids, and we'll talk about that in a little bit. So permethrin is a very commonly used insecticide pyrethroid that is used to basically impregnate clothing and mosquito nets to prevent insect exposures. It is also used topically for scabies and lice treatment, and it has a great efficacy. It works very, very well and has a very beneficial safety profile. We don't see a lot of adverse effects from this. Permethrin was also very useful for preventing West Nile virus and Zika virus over the last 20 to 30 years. As I mentioned before, since the mosquito is a primary vector for transmission of diseases, we see that this was very effective in using with mosquito nets to prevent the transmission of specifically West Nile and Zika viruses. There have been pyrethroid spraying programs across the world to control our mosquito populations, and because of this, we have seen increases in human exposures to pyrethroids. However, we haven't seen much of a consequence from that. We've not able to even see detectable levels of any pyrethroid metabolites in humans after their exposure. So this is all good news, a very effective pesticide with very minimal effects, so we think, to humans. Next, I want to talk about another class before we start talking about all the specific toxicities, and this is one of the more insidious of the few. These are organophosphates and carbamate pesticides. So as you can tell by the background here, organophosphates are a lot more dangerous and should be handled with care. They were investigated very early on in Germany for use as pesticides, but quickly started to adapt to chemical weapons. If you've ever heard of sarin gas or soman or tabun gas, these are widely used as chemical warfare agents. As you've deduced, there's a potentially high fatality risk with these. And even the numbers, too, worldwide can be underreported due to pre-hospital deaths and complications. Most of the exposures that we see worldwide are mostly from rural and developing countries. However, current estimates are about 100,000 deaths per year due to organophosphates. And so in the United States specifically, there are a lot of regulations on the use of these. Now, growing up in rural Georgia myself, I know that these types of pesticides are still used and are very effective. However, there are lots of licensing and controls that are in place with government agencies that make sure that these aren't misused. However, sometimes it gets out. And so it's important to make sure that we all know what we're dealing with and know how to prevent any potential dangers with that. So with that in mind, what we see in the US are mostly accidental exposures to these organophosphates. So if excuse me, plants or agriculture fields have been treated with organophosphates, or even residential areas that have recently been sprayed, unknowingly people can come into contact with these plants and have that exposure to the organophosphate. Now, carbamates are still very similar to organophosphates, but not quite as insidious as the previous one. Carbamates differ from organophosphates in that there is less concern for permanent effects, whereas organophosphates have chemical properties that, if not treated or dealt with early on, it can lead to permanent effects and even death, whereas carbamates can still cause those effects, but they're not permanent. These were early identified in the 19th century as an extract of the calabar bean, which you can see on the left of the screen. It was seen in tribal cultural practices in West Africa as almost like a judicial practice to find witches and liars and other people who have broken the law. It was found to treat glaucoma in 1877. And then synthesis of the extract in the 1930s led to the development of carbamate as a pesticide, which was initially marketed as a fungicide. Now, moving forward, this is one of the more modern day insect repellents that we see very, very often, especially here in the United States. So DEET was patented by the U.S. Army in 1946 and has been commercially marketed since 1956. The Environmental Protection Agency estimates that about 38% of the U.S. population uses DEET. It has a superior efficacy to most other insect repellents, and which is great, it has the most toxicology information available. So we know how it works, we know the potential effects, but from what we see, it's quite safe. Over the last, let's say, 10 to 20 years, there have been movements to move away from chemical insect repellents and use more natural organic substances as insect repellents. due to concern that chemicals like DEET are not safe. And despite that movement, we have seen that it is safe for use when used appropriately. It works by affecting the mosquito's olfactory receptors, which is basically, for all intents and purposes, the same sensors and the equivalent of a mosquito's nose. So mosquitoes are attracted to you by detecting your temperature and your carbon dioxide emission. So usually they could smell that, and that's what attracts them to you. So DEET basically blocks those receptors, those senses, and prevents them from being attracted to you. So they don't find you, they don't bite you, and it works, from what we have seen, very, very well. So I mentioned the more organic and natural insect repellents. So I'm going to briefly talk about those here as well. So many of us have probably been familiar with oil of lemon eucalyptus or oil of citronella. The oil of lemon eucalyptus actually works quite well. It's similar efficacy to DEET from what we've seen. Whereas oil of citronella doesn't quite work as well. It does repel insects, but about within a meter of the application. And both have been shown to be relatively safe. So if your preference is to use the more natural and organic repellents, that these are good options and safe options to use, that they do work. Now that we've gone over a quick introduction to modern day pesticides and historical pesticides, I want to talk about why they've fallen in and out of favor and what potential health concerns and environmental concerns we may have. So let's start with DDT. So DDT has a relatively low toxic profile in very, very large amounts, large exposures. We have seen tremors occur. So not seizures, but like just shaking of the hands and bodies. However, there's a cousin to DDT that is called chlordicone, often referred to as kepone, which is an ant and roach repellent. This was a chemical that was produced in a factory in Hopewell, Virginia in 1974. Due to poor factory regulations and hygiene incentives, there were factory workers that were significantly exposed to this chemical for about 17 months. And this was referred to as the Hopewell epidemic. These patients, or these workers, began exhibiting significant hand tremors, fine head tremors, and ultimately whole body trembling, which they nicknamed Capone shakes because it was directly caused by this chlordicone exposure. So now this is not DDT. DDT, like in large amounts, like I said, can cause tremors, but the same class of pesticide has led to the significant effect. So ultimately, the adverse effects from this type of pesticide have been relatively mild. However, in like I said, large, chronic, significant exposures, we started seeing more of these tremor-like effects. Additionally, DDT and other organochlorines do have estrogenic compounds, or estrogenic properties, excuse me. And there has been concern over the last several decades that there is a potential for an increased risk of breast cancer development. Now, take this with a grain of salt, but it's been reported that there's a 1% increased incidence of breast cancer reported each year since the 1940s. And some attribute that increase due to the use of DDT and its environmental persistence. But at the same time, if you consider, since the 1940s, detection methods have become easier and more profound well since the 1940s. And there are so many other confounding properties here that may be skewing that data and may not quite go more correlate with the use of DDT. But I'm not saying it does, I'm not saying it doesn't, but that's something that is being considered. And in addition, in our diets, we still consume other estrogenic compounds that are considered to be more potent than DDT, which don't contribute to risk. So we don't quite know whether the risk is actually associated and correlated with DDT, but it's a current speculation that can't be dismissed. And lastly, it is a very, very stable compound, almost too stable. As I mentioned before, it's very persistent in the environment. And in 1962, Rachel Carson, who was a biologist for the U.S. Fish and Wildlife Service, she published this book, Silent Spring, which postulated the potential biomagnification of pesticides exposures through the food chain that eventually would lead to eggshell thinning in predatory birds. So what does that mean, biomagnification through the food chain? Well, here's a quick diagram of that. So you'll see on the far left, you have large amounts of very small organisms, small fish, filter feeders, etc., that are exposed to very small amounts of these pesticides. So once they consume leaves or vegetation, that might have been exposed to pesticides, that pesticide will persist in their bodies. And as they're consumed by each step of the food chain, it accumulates even further. So you have a larger fish on the next step of the food chain that consumes a large amount of these exposed filter feeders. That would increase that fish's exposure. And then the next step up, that animal will consume several of these mildly exposed fish, and so on and so forth until you reach the top of the food chain, where the animals at the top are widely exposed in comparison to the mildly exposed organisms at the bottom of the food chain. So that was the concern, and it was associated that eggshell thinning in predatory birds was being correlated to the use of these pesticides. And so the EPA at that point put a ban on the wide use of DDT in the United States in the 1970s to prevent further effects of this pesticide. So that's where we see DDT no longer being used in the United States, and a significant shift towards the use of pyrethrins and pyrethroids. So with that, let's talk about potential concerns with pyrethroids. So one of the most common adverse effects with these are actually allergic reactions, oddly enough. So since pyrethroids are derived from the chrysanthemum flower, there's still significant cross-sensitivity to those who are allergic to ragweed pollen. So if you have allergies to ragweed pollen, it's very possible that you can see allergic reaction to pyrethrins and pyrethroids. That's about a 50% likelihood of that happening. And so that's the most common thing we see. Now, as I mentioned before, there are a couple of different types of pyrethroids. And so type 1 actually works very, very similar to DDT. And where it differs is, like I said before, it doesn't persist in the environment. It breaks down very quickly. So its adverse effects are a little bit much more mild. You see tremors and twitching. And looking more at type 2 pyrethroids, you start seeing a little bit more of adverse reactions. So you can see increased salivation, nausea, vomiting, tremors, even seizures and confusion at worst case scenario. However, there's no real chronic toxicity there. It's all acute from single exposures. It's broken down so rapidly and effectively in mammals that there's no long-term concerns of that. Now, most of these effects are typically seen from ingestions. We can see some dermal absorption through pyrethroids and pyrethrins, but most of the time it takes a large amount of exposure to have these effects, and that's mostly through ingestion or, say, exposure to mucous membranes in the eyes and nose and mouth. But mostly from the skin, we don't see as much of a concern. So let's talk about DEET concerns. So DEET overexposures have minor to no symptoms at all. Now, same thing applies to the dermal exposures here. There is very, very little dermal absorption through topical application. And if we do see adverse effects, it's probably from an ingestion. Now, there are very severe effects that include seizures, but these are very rare reports and occurred through a extremely large ingestion of these chemicals. It is worth noting too that the co-application of both sunscreen and DEET can enhance absorption through the skin, but still it's not as significant as it would be through ingesting a large volume of DEET. While we're talking about DEET, I want to highlight a syndrome that has come to light over the last, say, 25 years since Desert Storm. This is called the Gulf War syndrome. About 25 years after Desert Storm, we started seeing a very high incidence of reports of veterans who were reporting strange symptoms that we couldn't quite figure out what the etiology was. Some of these symptoms included fibromyalgia, or resembled fibromyalgia. We saw chronic fatigue, irritable bowel syndrome. We saw rashes and headaches, memory impairments, insomnia, stomach issues. And we were seeing about 250,000 veterans, and still each year we see more and more reports as these come to light. The VA started referring to this as chronic symptom illness, chronic multi-symptom illness and undiagnosed illnesses, because the symptoms widely vary from patient to patient, and there's currently no overall consensus on the actual cause. However, there are some speculations. So originally, early on, the symptoms were attributed to the burning of oil wells in Kuwait. And so it was thought that the particulate matters were sent up into the air and exposed all the soldiers from the fires. However, as we learned further on, it was suggested that even after comprehensive reviews and studies of the Gulf War syndrome, it was thought that there was a vast exposure to pesticides, so large amounts of DEET, large amounts of permethrin, an ingestion of a medication called pyridostigmine, which is a basically preventative medication to protect the soldiers from a nerve gas. It was thought that excessive amounts of these chemicals, these medications, had something to do with the neurotoxic effect of Gulf War syndrome. And as of right now, effective treatments have been elusive, and still current research is ongoing to find treatment efforts. As of right now, it's more treating the symptoms as best as we can. But we still haven't quite narrowed down the actual cause, but this is the strongest thought as of yet. So before I go more into the organophosphates, I want to touch on the safety and considerations of our more organic insect repellents. So oil of lemon eucalyptus, I want to be very clear, this is not the essential oil, eucalyptus oil, which can be toxic if ingested. The EPA has determined that oil of lemon eucalyptus within a reasonable certainty has no harm to infants, children, and adults. So it is a widely safe insect repellent to use. And on the same page, oil of citronella is considered minimum risk as well, and is exempt from EPA registration. So it's there's very, very little concern here. It's not quite expected to cause harm to humans, pets, or even the environment. So as you can see in this picture, one of the most common ways to use oil of citronella is through the burning of candles and even like backyard torches. And so it's quite safe, minimally mildly effective, and it's safe to use in your home and backyard without having much concern. And now I want to talk about the organophosphate concerns, because there are lots of concerns to be had with these insecticides. So exposure to organophosphates and carbamates can cause what we in toxicology will call a cholinergic toxicity. And that means that you're going to see a dramatic increase in secretions. So you're salivating, it looks like you're crying, you have significant tear production, lots of mucus in your nose, throat, even in your chest, lots of vomiting, and even uncontrollable urination. It affects your heart rate, so it slows it down to dangerous rates that could potentially cause death. It increases secretions in your lungs, it makes it difficult to breathe, and even spasms in your airway that will lead to respiratory failure, so you stop breathing, and that also causes death. You'll see muscle spasms throughout your body and significant fatigue, blurred visions, and seizures. I don't think I have to say that exposure to this is a medical emergency and requires immediate medical attention. And there is an antidote that we can administer in the hospital for this. So that's why it's important, like if there is any exposure, that emergency care is sought out rapidly and you don't wait for that. So as I mentioned before, these chemicals were adapted to chemical warfare. We saw in 1994, 1995 in Japan, in Matsumoto in Tokyo, there were train station attacks with nerve gas sarin, which is an organophosphate. In March of 1995, there were terrorists that released sarin gas into 3 different subway stations in Tokyo that killed 11 people, and then in Matsumoto killed 19 people, and both attacks wound up with well over 5,000 injuries and people who were seeking immediate medical attention, overwhelming over 200, 300 hospitals and medical clinics throughout the city. And this was attributed to a doomsday cult. I'm probably not going to pronounce this right, but Shinrikyo, which was decided who was behind the attack. These events led to modern day chemical terrorism preparedness by governments and healthcare workers worldwide. And we see that here in the United States through a program called ChemPack, which this is a strategic stockpile of antidotes, personal protective equipment, and a few other odds and ends that would be effective in mass casualty chemical warfare, terrorist events. So this is how we prepare for terrorism and emergency response. So if you see on the picture on the right with the firefighters, these are large containers that are full of antidotes, personal protective equipment that are strategically placed throughout the country and in certain strategic hospitals that have a stockpile of things that we would need to treat those mass casualty events. And so if you look on the left, here are a few of the antidotes and medications that are found in those. And so you'll see atropine, which is one of the antidotes for organophosphates, 2-PAM as well, which is the second antidote that prevents long-term effects with organophosphates. And so I don't think I have to stress enough like how dangerous this could be in the wrong hands, and how it's important for us as healthcare workers to be prepared for those types of events. So lastly, I want to talk about precautions. So those are what I talked about before are things that could happen if you are exposed. But the best thing that we can do as healthcare providers, as nurses, as members of the community, parents, is focus on ways that we can prevent exposures, prevent things that could be potentially problematic. So the first thing I want to say as a toxicologist, it's very important that you use all pesticides, all insect repellents according to the label directions. The directions that come with them have usually usually come with the fact that they've been tested, and we know that using it this way will be considered safe. However, accidents happen, and so it's important to make sure that we use our best practices when using those. However, looking specifically at DEET, pyrethroids, and then oil of citronella and lemon eucalyptus, make sure that you avoid contact with your eyes and other mucous membranes, as it probably says on the label too. And that's kind of, as I said before, most of these don't have much absorption through the skin. However, in these mucous membranes in your eyes, you can see more significant absorption through that route. But also, they would be quite irritating in your eyes, and can probably cause some dangers and issues from that route. So it's important to make sure you avoid that. And then making sure you keep them away from children. If you're going to use them with children, that's okay. But making sure that you give close supervision and you apply that to the child yourself. So with that, one of my recommendations that I like to give very often is make sure pesticides, and honestly all household chemicals at that, are stored up and away in a locked container. So what does that look like? A lot of times people think, oh, if I put it under my sink, if I lock those cupboards, or I just put it on a high shelf, I'm okay. My preference is put it as high up as you can, where you yourself have to reach it. That way, like we all know that children and toddlers can climb. I myself, I'm a father of 10-month-old twins, and they get into everything. So it's important that in my household, I'm putting these as high up as I possibly can, so that there is no possible way that even if they started climbing, that they could reach it. So if you have to reach yourself and then you can lock those cabinets, you're likely in the best shape. So then when it comes to eye exposures, it's important that you use room temperature water to flush your eyes for about 20 minutes. So what does that look like? If you're at home and you get something in your eye, especially if it's uncomfortable, put your face under the faucet and run room temperature water over your eye for 20 minutes. Now, my best recommendation too is that you put the affected eye on the bottom, so that you don't have water running from the affected eye into the unaffected eye. So then you would have two eyes that are injured. So in this case, put your head under the faucet sideways and let it run down. And it's important that you let that happen for 20 minutes. However, if you have an exposure and you're working in like a hospital or a laboratory, or any type of building that has these dedicated eye wash stations, those are very useful too. So if you can see in the picture on the right with the character holding his eyes open and putting his face, at that point he would put his face down to the spigot and let that run for 20 minutes as well. Now, ingestions, these are more of a case-by-case basis. So it would be very difficult for me to give specific recommendations on all accounts on ingestions here. And so it's very important that if there is any type of ingestion exposure to these, that you call for advice. And there's a toll-free number for the Georgia Poison Center. It's 1-800-222-1222, where you can be transferred to a specialist in poison information, and sometimes even a toxicologist if needed. And so at that point, they can give recommendations on, they can hear your case and let you know things that you need to do, things you need to consider. So it's hard to make a blanket statement for ingestions, because that's where we see most of our toxic effects, which is why I stick with my recommendation up top saying keep all chemicals up and away from children who could possibly ingest these. Now, to touch specifically on organophosphates and carbamates, these are, like I said, the most dangerous here. And it's important that when using these, one, that you're properly trained and licensed to use them, but also make sure that you're using proper personal protective equipment to protect your skin, to protect yourself and others. while using it. So making sure you're avoiding skin contact, because there is potential dermal exposure. You can inhale it. It can get in your eyes and mouth and your mucous membranes and absorb that way. If you do get it on you, it's important that you remove and dispose of all the soiled clothing. Leather clothing specifically needs to be permanently destroyed, whether that's through burning or tying up in a bag and finding recommendations that way, because you can cause further secondary exposures if not addressed appropriately. Once you've removed your soiled clothing, immediately wash the affected area and seek immediate medical attention. So that is a 911 call. While you're removing the exposure, it's important to have EMS on the way to, at the very least, evaluate. Even if you feel fine, if you don't have any symptoms, it's important to have that evaluation, because it's such a potentially dangerous chemical. And with that, that is all I have. So if you feel like you have any questions about pesticides, or any exposure for that matter, we are always available here at the Georgia Poison Center to take your calls, to take your questions, and help direct you as needed. And again, like, that phone number is 1-800-222-1222. Thank you so much for tuning in today. And at this point, I will take any questions if you have them.
So if anyone has any questions, there is a question box to the right of the webinar. So if you want to type them in there, and we can pass them along to Connor. So it doesn't look like we have any questions. I did type the link to the survey if you're interested in receiving your certificate. And thanks, Connor, for putting that on the screen. So if you have any questions, you should have my email address from the webinar registration. You can always reach out. Oh, hold on, one just came through. Why would you use a lower percentage of DEET over a higher one if there's such a low change of adverse effects?
So again, it comes to the potential for overexposure. So as I said, I'm not saying that there is no concern at all for any toxic effects, but the safety profile is low. So using a higher percentage, you're increasing chances of, especially in more of a significant use, you're increasing the chance that there would be adverse effects. However, I wouldn't be quite as concerned. Now, when you use higher percentages too, you might start seeing more irritation to your skin, depending on how each individual responds to that. So that might be more of a personal preference as well. But that's still, using higher percentages kind of falls more into that increased significant amount of exposure. So if it works really well at lower percentages, it's probably more beneficial to you to use that lower percentage. However, if you're more in like an endemic area where you're going to have lots of concern for insect exposure, then it might make more sense to use a higher percentage. But it's just that risk benefit at that point.
The next question is, do you know what is usually used by companies to spray for mosquitoes?
So previously it has been significantly the pyrethroids that have been sprayed around. The use of organophosphates is more specifically just agriculture and are not sprayed into residential areas like that. And like I said before, historically it's been DDT, but if we're using any like spray programs to spray around, it's most likely going to be those pyrethroid types.
And then the last one is, I understand pesticides can be accidentally exposed to. What about intentional exposure, abuse, etc.?
In terms of intentional use, that was usually always a healthcare call. So if you have yourself or know of someone that have intentionally used pesticides to cause harm or have any other effect, that is definitely a situation that I would recommend that you call the Poison Center and seek immediate help. Because there are a lot of factors that play into self-harm. So that's not something to be taken lightly for sure. So I can't quite say that every case would have a toxic effect or every case would be just fine, but that's definitely something that you should get an expert opinion on each time. Hopefully you don't encounter that situation, but if that does arise, calling us at the Poison Center first is definitely the way to go, and we can give you direction at that point.
All right, so that's all the questions. I just want to thank all of you guys for viewing this webinar. And as a reminder, I will send out another email with the survey link as well. So thank you.
All right, thank you, everyone.